This is the story of how artificial intelligence has the potential to not only fix the problems in healthcare, but completely reimagine healthcare so that we can advance health and care across the globe. We live in an era of unprecedented transformation, where artificial intelligence is not only redefining industries, but it's shaping the way we feel and experience the world around us. And nowhere is that as urgent as in healthcare, an industry that is deeply personal and highly complex, where artificial intelligence has the ability to save lives or the potential to take it away if we use it irresponsibly. Here's the unfortunate truth. Healthcare is a legacy system that is misaligned for modern needs. And that's not because we don't have caring physicians and nurses who work really hard or groundbreaking therapeutics. It's not because of lack of resources or poor intentions. It's because healthcare is a system that's antiquated and inefficient. That's led to a couple of devastating outcomes, including a broken system that is unsafe, with 250,000 people dying every year because of preventable medical errors, making it the third leading cause of death in the United States. We have a workforce that is burned out, with 50% of physicians and nurses reporting signs and symptoms of burnout. We're actually projecting that over the next decade, we're going to have a shortage of over 100,000 providers. And a nation that is becoming bankrupt under the insurmountable costs of healthcare. We are surpassing $4.9 trillion in annual healthcare costs. And yet 1 in 3 Americans are skipping critical care because they can't afford it. Now, fortunately, artificial intelligence gives us the opportunity to rewrite that script. Here's the big idea. For us to actually fix healthcare, we can't just put these tools on top of an inefficient and antiquated system. We have to reimagine what healthcare needs to look and feel like. And for us to reinvent healthcare, we need 2 key elements. We need to unify all health data, and we need to apply intelligence to it. We need to unify health data because we need to change from looking at patients as individual diagnoses to a person throughout the entire continuum of their life. Right now, healthcare data is highly siloed. We have electronic health records that don't effectively communicate with each other. We have payers and insurers that have a lot of data, but they don't have clinical insight. We are generating a ton of wearable data that's not really being used for anything. We actually need to bring all of that data together. And that's not just a pure interoperability problem. That really kind of brings me to the heart of what it takes to truly understand health and care, and that's the 2080 problem. If I asked you what determines someone's health, many of you, including those of us in healthcare, would say it's US News and World Report top hospitals. It is highly trained physicians. It's groundbreaking therapeutics. But here's the uncomfortable truth. What happens within the 4 walls of a healthcare delivery system is only 20% of what determines a person's health. The other 80% is the air we breathe. It's the food we eat. It's the stress we carry. It's our genomics, our habits. It's where we live, work, and age. And that's the disconnect. Unless we're able to bring the 20% together with the 80%, we are unable to fundamentally understand the root cause of health and disease and be able to help people. And AI can help us do that. In no other industry would we find it acceptable to operate the way that we do in healthcare. Imagine this with me. You're sitting on a plane, pilot comes on, says, "Ladies and gentlemen, we are anticipating a very smooth flight to our destination. I just have to let you know that I only have 20% of the data to get us there safely, but don't worry, I'm highly trained, very well-intentioned." Would you find that acceptable? And yet that's what we find acceptable every single day in healthcare. But unifying data is not enough. Once we have the data, we need to apply intelligence to it, because data without intelligence, it's just a bunch of noise. We actually need to go and transition from being data-rich and knowledge-poor to having actionable insights that can actually help impact disease. And this is where, again, AI and generative AI are absolutely instrumental. Once we've pulled all the data together, they can look for patterns in the data. Before you develop signs and symptoms of disease, they can actually predict and be able to prevent disease. You can actually focus on that 80% and be able to provide personalized insights and personalized recommendations, because healthcare should not be one size fits all. There is what is clinically the right thing to do, and then there's also what is your personal preference, which will be different than what's my personal preference. We need to get healthcare that fits our needs. And then all of this needs to become participatory. And again, generative AI and large language models have now enabled us to do that by being able to synthesize that data in a way where we can get real-time information and actually have it be something that we can dialogue with back and forth. This is how we rewrite the script for healthcare. And here's the future that's possible. An always on, always yours healthcare. Imagine having a 24/7 health agent with you that can go through your day with you and make recommendations based on what your health activities are, from nutrition to sleep to activity. Again, the 80%. It can help guide you through the 20% when there's illness and you have to navigate healthcare delivery systems. We can transition our workforce from burnout to purpose. We can make sure that instead of our highly trained nurses and physicians spending more than 50% of their time on documentation and non-clinical work, that they're actually using their highly trained education and becoming partners in care with us. And we can create a society that is highly innovative and productive. Imagine reallocating trillions of dollars to education, innovation, research, the environment. Because a healthier society doesn't just cost less, but it is more creative, it's more innovative, it's more productive. And it's able to tackle the biggest challenges that we have in healthcare. This is how we rewrite the future of healthcare. And all of this is possible if we proceed with intentionality. Imagine this. There's a paperclip company, and they want to increase their paperclip production. And so they implement a state-of-the-art AI algorithm. At first, it's like magic. They optimize the supply chain, the factory operations are going really well. They even optimize their distribution channels. Paperclip productions go through the roof. They are making more profits than ever. And then the paperclip algorithm realizes that it can further optimize production by melting down the metal in the furniture and the factory infrastructure, because they need that metal to make paperclips. And then it realizes that it can actually optimize the minute-by-minute work of the workers to be able to optimize paperclip production. And then as time goes by and they're making a lot of profit, the algorithm realizes that they can actually buy schools and hospitals and actually melt the metal that's in those infrastructures to be able to make paperclips. And the story goes on. And obviously, this is a thought experiment, a fable of AI gone rogue. But here's the really terrifying thing. AI doesn't need malice to be dangerous. It doesn't need to turn evil or have consciousness for things to go horribly wrong. It needs a poorly defined goal, the idea that efficiency is good at any cost, and lack of oversight. And if you think this is far-fetched, this is already happening in our world. We have social media companies that are optimizing for engagement, but spreading misinformation. We have hiring AI algorithms that trained on historic data and have therefore encoded bias into hiring practices. We have financial bots that have created instant instability in financial markets because they were optimizing for one factor without considering the bigger picture. And we see this in healthcare as well. We have diagnostic algorithms that trained on historic data that when it comes to diagnosing Black patients, they are 33% less accurate than their cohort white patients. We have seen chatbots working with mental health patients who were considering ending their life and having the chatbots tell them to think more positively instead of escalating care. And we have insurance companies that were trying to create more efficiency within their system, denying care for patients, not because the care wasn't warranted, but because it wasn't efficient. This is the paperclip problem in action. The lesson here is not that AI is dangerous, it's that it is indifferent. Our future with AI is not just a technical one, but an ethical one. And we have a choice. We can either leverage AI for continued efficiency without any oversight, or we can build in transparency and accountability into what we do. And that's really a shared responsibility, from the vendors who come up with the algorithms to healthcare delivery systems, doctors, nurses, patients who use them, to insurance companies, pharmacies, the entire ecosystem of healthcare. It is our shared responsibility to do this. So as executives and leaders, there are 3 key things that we have to do. The first one is to make sure that we advocate for purpose over hype. We can't implement AI algorithms because they're the new shiny tool. We have to be clear on what is the problem that we are trying to solve, and is the AI technology the right solution for that problem? We have to make sure that these algorithms fit in the workflow of the people who are doing the day-to-day work, because we know that technology only succeeds when it is seamlessly and flawlessly integrated into workflows. And lastly, we have to acknowledge that trust is earned, not downloaded. For us to build trust into these systems for healthcare, we have to ensure that the AI algorithms are training on the right data and that we have the right oversight so that we're continuing to monitor for unintended consequences as we move through our dynamic world. Again, the choice is ours. We can continue to optimize for efficiency, or we can leverage AI as a force multiplier for good. The future of healthcare is not in AI's hands. It's in ours. Let's make sure we get this right. Thank you.